So hi, everyone. Welcome to our webinar today on public health and climate change impacts in Alaska with Dr. Micah Hahn. We are so excited to host you this morning, this afternoon, and we can't wait to have a robust discussion about Dr. Hahn's research from ticks to wildfires and what that means for community adaptation to public health concerns. This webinar is being put on by the Migration in Harmony Research Coordination Network, which is a National Science Foundation funded network that brings together practitioners, scholars, decision makers together to discuss and to solve challenges around Arctic migrations, from ticks moving north to fire and ecosystem ranges moving north to ships and military challenges moving north. If you have not joined our free network yet, I highly encourage you to do so after this webinar so you can join us for future webinars and hopefully an in-person meeting in Anchorage next year. Today's webinar is going to be recorded and will be put up on YouTube later in the week. So if you have to leave a bit early, no worries, you can always catch the recording later. Everyone should be muted now, and I ask that you please leave that mute on throughout Dr. Hahn's presentation. Dr. Hahn will share her presentation for the first part of our webinar today, and then we'll move into an exciting question and answer and discussion portion afterwards. If you have questions for Dr. Hahn about what she is presenting throughout her presentation, please type those questions in the chat box. I will be monitoring the chat throughout her presentation so that we can collect your questions and ask and answer them once the presentation is finished. And finally, if you have any technical challenges, please feel free to also put those questions in the chat box or direct message me so we make sure that you are getting everything out of this webinar that you can. So without further ado, I am going to introduce our speaker, Dr. Hahn, who is an assistant professor of environmental health within the Institute for Circumpolar Health Studies at the University of Alaska-Anchorage. I am so excited to host you, Dr. Hahn, today, and I can't wait to hear what you'll share with us about your research on public health and climate change in Alaska.
Awesome. Good morning, everybody. How's it going? Can everyone hear me okay? Give me a thumbs up. Awesome. Thank you so much for that really nice introduction. And thank you all for joining. This is pretty fun. I'm really excited to have such an eclectic group of people together. This is a very cool, venue to be able to share some of what's going on up in Alaska. And I'm excited to present to you, but I'm actually almost more excited for the discussion and Q&A afterwards, because just glancing through the participant list, there are a lot of folks from Alaska who've been involved in many different aspects of this research, and I would love to hear their input. And then also it's very cool that we have people from other Arctic nations, other places in the lower 48. I'm just excited to hear everybody's thoughts and perspectives. So I'll get through the presentation so that we can have a discussion. All right, let me share my screen here. Okay, Victoria, does that look okay? I can't see you, so you'll have to just give me a verbal.
Great to me.
Awesome. Okay. Well, Victoria already gave me a little bit of an introduction, but since one of the goals of this webinar series is to get to know the people in this network, I thought I would take a little bit more time to explain what I do and sort of my disciplinary background. So I'm an environmental epidemiologist, which means that I work to understand how changing environmental conditions impact human health. And I focus specifically on environmental exposures related to climate change. And I've found is that I've started to move my work into working with communities to develop interventions to protect public health. A lot of these exposures are really multifaceted, and require more of an integrated climate adaptation and resilience planning that involves municipal governments, multiple agencies and departments, research and public outreach. And this has been a pretty fun new component of my recent work. And when I'm talking to people from other disciplines, I find it really helpful to know sort of what are the methods that they use. And that helps me sort of ground where the approach that they're coming from. And so for me, I use things like statistical modeling or ecological modeling, spatial analysis and GIS, remote sensing, ecology fieldwork. To collect information from people, we use a lot of surveys and focus groups. And I think one of the key skills, particularly in a place in Alaska, where there's often a dearth of data from a particular source that you're interested in, is data triangulation. So basically being creative about where you can pull information from to sort of put together a full narrative. And then facilitation, I mentioned a lot of this work is moving into climate adaptation and resilience planning. So I'm often working with communities and governments and working through problems with them and thinking about how to do that in a really collaborative way through facilitation techniques. And then additionally, in the summertime, I work with my husband on our commercial fishing boat. Whoops, how do I advance this slide? There we go. And this out of Cordova, which is over in Prince William Sound. And I escape for a few weeks each summer to go help him out also. All right, so climate change impacts human health through a variety of direct and indirect pathways. And this is a figure from our US Centers for Disease Control and Prevention. And it's meant to be very comprehensive and describe a wide variety of human health impacts. But obviously these vary regionally. We're facing some pretty unique consequences of climate change in Alaska, some of which I'll share today. But before I turn to the next slide, I want you to notice that inside the circle of the health impacts, there are specific examples of changes in climate that are linked to the health outcomes. Whoops, right here. So we have rising temperatures, more extreme water, rising sea levels, or increasing levels of CO2. And so the CDC and others have started to conceptualize these climate drivers in a framework for thinking about those connections between climate and health. The most simple model is a linear framework from climate drivers all the way through the health impacts on humans. And in this framework, climate drivers are the specific climate change that leads to an environmental condition. An environmental condition is what arises in response to a specific climate change. And an environmental hazard is what directly leads to a negative health effect. So for example, in the case of something like flooding, increased precipitation would be the climate driver. Flooding is the environmental condition. Contaminated water is the environmental hazard that actually causes the health effect, which in this case might be waterborne infections. And so while I like how this conceptual framework breaks down the connections between physical changes in climate and health, it makes it look a little too neat and linear. And some things are really just a bit messier. So for example, let's think through how changing sea ice is impacting human health. And if you were in my class, I would make you guys participate, but since it's a little tough in this webinar format, I'll just explain sort of the narrative of what's happening. Basically, increased temperatures are causing later sea ice, which impacts hunting access for people that traditionally go out onto the ice for whale hunting during these seasons. In addition to not being actually able to go out on the ice when it's out there, it's more unstable. So there are more dangerous hunting grounds, which leads to lack of culturally relevant and nutritious foods. And then the health effect eventually is poor nutrition, potentially mental health impacts, or injuries from hazardous hunting conditions. So like changing sea ice, many of the most prevalent health impacts in Alaska are the result of complex ecological pathways that are difficult to untangle. And this makes it really difficult for traditional epidemiologic methods where we're trying to study these associations between some environmental exposure and a health outcome. So it gets really complicated very quickly. So this is an example of that same framework that we did in one of my classes. And we had everyone map out different health outcomes starting from different climate drivers. And so you can see that in some cases, you have that nice linear flow from climate driver to health outcome, but a lot of times it's more complex, interacting, different environmental hazards cause different health outcomes. Many different climate drivers sort of get to health through different pathways. So for example, a lot of times people talk about decreased salmon runs or poor air quality as health outcomes, but really in this framework, they would be considered environmental hazards. So on one hand, I know this totally seems really semantic, but particularly when you're working with interdisciplinary teams, I think it's really helpful to have a common language and a framework to make sure that you're talking about the same thing. And also, I think that mapping out the exposure pathways can help you define your research questions and think about all of the data that you need to answer your question. And before I dive into an introduction of Alaska, I wanted to provide one more quick framework for a lot of the work that's happening on climate and health. Let's see. I don't know if I have a pointer here. Oh, maybe I do. Let's see. All right, so a lot of traditional epidemiologic research sort of falls in this bucket, characterizing health impacts. So like I said, looking at associations between an environmental exposure and some health outcome. I've found that particularly in my first few years in Alaska, we actually can't get to this part yet because we're missing some of the data that we need to be able to ask these questions. So sometimes setting up surveillance systems, one of which I'll talk about today, is a really important step to be able to understand how climate change is impacting health. In addition, I already alluded a little bit, once we understand what these health impacts are, we can use that information to help identify adaptation strategies. And then finally, once people have put interventions in place, we can create evaluation strategies to understand if these programs are working and if they're truly helping protect public health. All right, so I know we have a lot of Alaskans on the call, but it seems like we have a lot of people from outside of the state as well. So I wanted to provide a little bit of context before I get into the health impacts. So I'm going to highlight a number of demographic, cultural, and environmental characteristics of Alaska and residents in the state that are unique compared to states in the contiguous US. A lot of the funding for the work that I'm doing comes from US government agencies. So I find that it's really helpful to sort of share this context when I'm putting together grant proposals, for example. And so I know this is also an international audience. So some of the things I'm about to highlight might look very familiar if you're from other Arctic areas. Okay, so this is one of the key figures that Alaskans like to show. If Alaska were overlaid on the contiguous US, it would reach from Florida to California and stretch from northern Minnesota down to Texas. The state contains a wide variety of ecosystems, including Arctic tundra, coastal rainforests, maritime meadows on volcanic islands. And given the size and ecological diversity in the state, it's not surprising that there is huge variation in the climate-related environmental changes that are happening throughout Alaska. And so as we begin to think about the impact of these changes on the health of Alaskans, I think a key starting point is that your exposure to climate-related health threats really depends on where you live in the state. So for example, in northern Alaska, the retreat of sea ice has left coastal communities vulnerable to storm surge and coastal erosion. In interior Alaska, thawing permafrost is really a challenge for roads and infrastructure. Warming oceans and changes to the maritime ecosystem are putting pressures on fisheries that are really important for the economy of a lot of coastal communities. And in South Central and Southeast Alaska, warming temperatures support a more rapid spruce bark beetle reproduction cycle, which makes our forests much more susceptible to wildfires. So mapping out the climate and health impacts in Alaska really, it necessitates a regional approach. It's really hard to think of a one-size-fits-all approach for understanding how climate change is affecting health in a place as big as Alaska. Okay, so over half of Alaskans live in the major population centers of Anchorage, Fairbanks, and Juneau, but the majority of Alaskan communities have less than 1,500 people. Only 13 state roads connect urban centers, and much of the state's population live in communities that are only accessible by boat or plane. And most rural villages are not connected to a major power grid. Many communities lack indoor piped water and sewer, and instead rely on hauling water from a community water facility or using a communal washateria to do laundry, showers, flush toilets, and sometimes have bucket toilets inside of their homes. The lack of road access and geographic spread of all of our communities really limits the availability of healthcare and emergency response resources, and really defines how people get goods and food, for example. While there's usually a grocery store or a general store in each community, a lot of people supplement these household goods with trips to bigger hub communities and take things back on planes and ferries with them. Many Alaskans rely on subsistence hunting, fishing, and gathering as part of their household food supply and livelihood. This reliance on customary and traditional uses of wild renewable resources means that changes in the distribution of key animal or plant species could significantly change dietary patterns or affect a household's main source of income. For example, up in the top right corner, you see commercial fishing is also a really important part of the economy in Alaska. And so changes in resources such as salmon or whale really affect households through a variety of paths. The lack of a paved road system connecting much of the state means that Alaskans often utilize unique forms of transportation. In particular, during the winter, many frozen rivers transform to highways connecting communities that are normally separated by wilderness. For example, there's often a big ice road of nearly 200 miles is constructed in Southwest Alaska, and people rely on that wintertime road system to be able to bring in supplies during that season and also travel to sort of the main Bethel, which is the main hub community down there for medical appointments or shopping and that type of thing. Permafrost is found beneath about half of Alaska, and it has been thawing in Arctic regions of Alaska since the 1970s, with the highest rates of near-surface warming in the North Slope, which is up in the farthest north part of the state. And as I mentioned, a lot of the infrastructure in interior Alaska is bending, breaking, and just suffering because of this. The ground underneath is beginning to shift. And one of the starkest indicators of climate change in Alaska is changing sea ice. Sea ice plays an important role in regional climate, human activities, and ecosystem functions in the northern part of the state. As I mentioned, hunting really depends on sea ice in these communities. These are recent maps from the University of Alaska Fairbanks of the Chukchi and Beaufort Seas, and they demonstrate the substantial decline in sea ice that has occurred in the waters around Alaska in the past couple of decades. Because of this loss of sea ice, there's open water off the northern coast of Alaska for 3 to 4 months per year, compared to maybe a few days or weeks per year in the 1980s. Okay, so now I'm going to turn to, we talked a little bit about sort of the context of Alaska, both in terms of the climate and infrastructure and distribution of the population. And now I'll turn to a brief overview of some of the major health impacts of climate change in Alaska. So as winters are becoming shorter and warmer, thinning ice has made travel conditions more hazardous. An epidemiologic assessment of falling through ice events in Alaska between 1990 and 2010 showed that over a third of the events ended in a fatality, and over half involved travel by snowmobile. In contrast, in urban Alaska, warmer winters have led to a higher frequency of rain on snow events. That's what you see over in the right-hand side with someone ice skating down the street. This has challenged road maintenance crews to keep roads ice-free and safe for automobile travel in order to prevent injuries and deaths from road accidents. In 2012, Alaskans harvested almost 50 million pounds of wild fish, land and sea mammals, and wild plants for personal use. And this varies by urban and rural communities. So for example, in urban Alaska, people harvested about 22 pounds a person, but in rural Alaska, that number is about 295 pounds a person. And this provides about a quarter of an average daily caloric needs in many rural communities. So you can see how a poor salmon return or a salmon die-off event can really impact food resources in a household. I don't have a picture here of this, but ice cellars are vertical shafts that are built down into the permafrost and used as frozen food storage, typically for subsistence meat, for example. in many rural communities in northern Alaska. And residents have reported that ice cellars are failing more frequently. A decade-long monitoring program and a handful of cellars found that although the temperature inside the cellars did not increase, the condition is starting to deteriorate. They're starting to see flooding inside some of the cellars. Without safe food storage, harvested wild meats could spoil and leave households without a consistent protein source. And then the picture on the left here is of a shellfish monitoring program. And that's another important link between a changing climate and food resources in Alaska. So harmful algal blooms produce a toxin that accumulates in shellfish and can cause paralytic shellfish poisoning. When you consume a shellfish that has this toxin in it, it can cause a neuroparalytic condition. Butter clams, mussels, razor clams, and cockles are some of the most commonly harvested shellfish by Alaskan residents that have known to have high levels of PSP. And there are a few shellfish monitoring and testing programs in Alaska, but they're very regionally based. So we have a very limited picture of sort of what's happening at a statewide level. Mental health is a vastly understudied impact of climate change. And there are a number of potential stressors in Alaska. For example, acute events such as a wildfire or extreme coastal storms, and the associated destruction and loss of property could cause a lot of stress for households. Stress from traveling in unusual conditions such as unstable ice, not knowing if these roads that you've depended on for so long are as sturdy as they traditionally are. Loss of cultural sites such as graveyards, traditional burial grounds, and as I already mentioned, impacts on wild food resources, the unpredictable nature of wild foods, and changes to the environment that make hunting or fishing more difficult can be a huge stressor for families. Similarly, if your livelihood is commercial salmon fishing, having changes to that resource can be very challenging. And I'm sure many of you have heard about several Alaska Native communities have already or are already making plans for relocating due to threats from flooding and erosion. Is a huge shift in livelihood, sense of place, concerns about safety and disruption just from having to uplift your entire community and move it somewhere else, obviously is a huge source of stress for these communities. Although heat-related illness and death has not historically been a concern in Alaska, recent record-breaking summer temperatures have opened up this conversation within the public health community. For example, last summer was one of the hottest on record in Anchorage, and this is something that we've been talking about with the Anchorage Health Department. Extreme heat exposures are defined in comparison to the average temperature in an area. So this means that an 85-degree day in Anchorage may have a different health impact than an 85-degree day in Texas, for example. Epidemiologic evidence shows that an increase in temperatures have a bigger impact on heat-related deaths and hospitalizations in areas where temperatures are typically cooler. And that part of that is because of acclimatization. We're just not used to the weather, but also infrastructurally, very few people in Alaska have air conditioning or other strategies for escaping the heat when it gets too warm. And additionally, in Alaska, buildings are designed to keep heat in. And so we just aren't used to having these higher than normal temperatures. Another thing that we saw last summer was sort of the dual exposure of heat and smoke from a very severe wildfire season. And people were in this catch-22 where they wanted to open windows to create a cross breeze, but they couldn't because the air quality outside was poor. And so people were really struggling to figure out how to sort of escape this double whammy. Water and sanitation infrastructure in many rural Alaska communities is threatened by thawing permafrost, extreme storms, and erosion. The lack of solid ground means that pipes are bending and breaking. This is on the right, there's a picture of a sewage lagoon. And any damage to this infrastructure can cause contamination of water sources that people are using for drinking, washing, or laundry. Thawing permafrost can increase the turbidity of surface water, and erosion and shifting ground can cause local lakes and reservoirs to drain. And then the last two things that I want to touch on, I'm going to expand on quite a bit in the rest of this presentation. So I'll just briefly say that as winters become more mild in parts of Alaska, there's concern that vectors like ticks and mosquitoes may be able to survive in places where they had not been able to before. And I will tell you a little bit about the work that we've been doing on tick-borne diseases in the state. And in terms of air quality impacts, I'm going to dive into our work on wildfires a little bit, but I also wanted to talk about that picture on the right is actually of pollen. And so pollen and mold are other important climate-related environmental exposures in Alaska. People with allergies or asthma are particularly affected by these irritants. And we have pollen and mold counting programs in both Anchorage and Fairbanks. And the counts from these cities have shown in recent years, pollen counts are an order of magnitude above levels considered high by allergists. And the main source of pollen in Alaska is birch trees. And then finally, dust from vehicles on dirt roads and windblown dust from dry riverbeds and glaciers is another source of air quality concerns in Alaska. When we have particularly dry and warm conditions in the summertime, this can exacerbate dust events and cause respiratory problems for nearby communities. Okay, I see some things are coming through the chat, so I'm looking forward to those questions. Victoria, if anything needs to be answered in the meantime, please just give me a shout. And if not, I will continue on. Okay, so now I'm going to talk about two projects that we've done in Alaska to address both tick-borne diseases and wildfires. So the first is really this comprehensive study that we've been doing to understand more about the changing risk of ticks and tick-borne diseases in Alaska. So briefly, prior to this study, six species of ticks have historically been found in the state. I will loosely refer to these as native ticks. When you're talking about native or non-native species, there's not really a definitive cut point for when a new species becomes endemic in an area. And so I will talk about those ticks that have historically been here, which are two mammalian ticks, two bird ticks, and two seabird ticks. And while we have had ticks in the state for a long time, over the last decade, a number of non-native tick species have been arriving in the state. These are particularly important because they are known vectors of tick-borne pathogens in the lower 48. They cause some of the most common tick-borne diseases in the United States, including Rocky Mountain spotted fever, tularemia, and Lyme disease. In each year, approximately 30,000 cases of Lyme disease are reported to the CDC by state health departments. But recent estimates using other methods besides just patient reporting suggest that there are approximately 300,000 cases of Lyme disease in the United States each year. But in addition to causing problems in terms of tick-borne pathogens, sometimes ticks are a problem as a parasite themselves. So in this picture, this moose is covered in either winter tick or moose tick. People from other Arctic areas or from northern Minnesota or Canada might recognize this picture because this tick is endemic in those areas. And essentially this tick stays on a moose for their entire life cycle, which means that the population can increase very quickly. And sometimes moose are found with tens of thousands of ticks on them, causing anemia, hair loss, obviously distraction, and it causes them to stop eating. So this is a really important problem for moose populations where this tick is introduced. And we know that this tick exists in Canada and Yukon and Northern Territories. We have not found evidence that this tick is in Alaska yet, but this is a really important part of the surveillance program, particularly for our Fish and Game Department. And if we look at what's going on with ticks and tick-borne diseases globally, we're seeing that ticks are spreading into new regions, and we're seeing an increase in tick-borne diseases, particularly at northern latitudes. So we can't really know how things are changing in Alaska if we don't know what things look like today. And really consistent and systematic methods for collecting tick records across the state are key to establishing this baseline for ticks and tick-borne diseases in Alaska. And so we've done this through the creation of the Alaska Submitted Tick Program. So this is basically a passive surveillance program where anyone that finds a tick in the state, whether that's public, veterinarians, biologists, other researchers, if they find a tick on themselves, on a pet, on a wildlife, or in the environment, they can turn it in to the Alaska Department of Environmental Conservation. We'll ID it, test it for pathogens, and then add it to our growing database of ticks in the state. We've developed a number of outreach materials that go up in Forest Service or Fish and Game offices, that one in the middle, or in vet clinics, the one on the left, to sort of spread the word about the Submitted Tick Program. This is very similar to a lot of passive surveillance programs that are happening in other areas that are sort of on that northern edge of tick distribution. This is a key way to be able to do surveillance across a huge geographic area with very limited resources from the state government. So in addition to having the Submitted Tick Program, we sort of took this threefold approach for collecting tick records and specimens over the bulk of this research project. So in the bottom left, we had the Submitted Tick Program. We also did a very comprehensive review of basically every tick record that has ever been found in the state through Arctos as an ecological database, but also literature reviews. Sometimes people will be doing a study on voles, for example, in Southeast Alaska, and they mentioned somewhere in the paper that they found ticks. So we pulled those records out when we had available information. And then we also did a lot of field work. So in the top right-hand corner, you'll see them dragging for ticks in the woods. That's what they're doing with those dirty blankets, basically, checking to see if they can find ticks that are questing, looking for hosts. We also did some small mammal trapping and worked with bird biologists to collect ticks off of birds that they're collecting in their long-term monitoring programs. We've put all of this together into that article in the bottom right there, which is sort of this baseline for what we know about ticks in Alaska as of 2019, essentially. And so I'll briefly review where are ticks found, when are they questing, and are they becoming established? These are the three questions that I'll go over and try to answer for you today. So over the last century, we collected records of over 4,500 ticks in Alaska. Most were native, or those ticks that were historically found in the state. And all I'll say about these ticks is mentioning where they are, so you have a sense of where we're finding ticks in Alaska. So let's see here, I'll turn on my laser pointer. Ixodes angustus is our squirrel tick. Most of those records are coming from Southeast Alaska and South Central, although there are a few records from interior. Ixodes urae is a seabird tick, so that's why they're coming from the Aleutians and out in the Bering. On the islands out here, there's also Middleton Island. We come in the Sound, we find those ticks on birds pretty often. And then this is our rabbit tick. And most of those records are actually pretty old and have come from trapping studies that were done in interior Alaska near Fairbanks a couple of decades ago. And so we don't have very few records of this tick, but we know that it's endemic in that area. Okay, so now I'll focus only on the non-native ticks. So remember, those are the ones that are new to the state. Most of them are coming likely from the lower 48. And the reason we care about them is because they are known vectors for tick-borne pathogens. So they're the ones that can cause human disease. So the numbers of ticks are increasing. I think a lot of that has to do with awareness, particularly between 2018 and 2019. We did a lot of outreach about the Submitted Tick Program. I think what's exciting is that once we sort of reach a plateau in terms of people's awareness of ticks in the state, that we'll be able to have more consistent surveillance records and can kind of monitor whether that increase is because more people know about ticks or because we're actually seeing an increase. We've found 8 species of non-native ticks, again, all of which are important vectors for human pathogens. So most ticks were submitted between May and September of every year, with a peak from June to August. However, we did have ticks submitted throughout the year. In most months, the majority of submissions were of tick species that have historically been found in Alaska. That's these dark blue bars. And this is really what we would expect in terms of the life cycle of ticks. So this is an example of the life cycle of a black-legged tick, which is the tick responsible for transmitting the bacteria that causes Lyme disease. And you can see they have a 2-year life cycle. They basically overwinter and sort of hide under the snow in the during the winter time, and then they emerge as nymphs in the spring. And in spring and summer is when they're out looking for a blood meal. And so this is usually when people are coming into contact with them. And when we talk about the risk being the greatest for acquiring ticks and tick-borne diseases. So that sort of lines up with when we're getting submissions in Alaska. In January and April, more non-native ticks were submitted during these time periods. This is likely because these are times when Alaskans and their pets are traveling out of state and bringing ticks back with them. So you can see over in January and April, we have a larger number of these non-native tick species. Okay, the majority of contemporary tick records were submitted by the public, followed by veterinarians and biologists, and human health professionals submitted just about six records over the last decade. We did a lot of outreach through veterinary clinics and Facebook. I give a lot of talks at local science events, science pubs, and the Nature Center. And I think this speaks to how interested people are participating in citizen science, particularly when it's about things that are gross, like ticks. People love to talk about them. And so I've got a lot of engagement from the public in submitting tick specimens, which is great. Okay, and I think the key question, what I'll end on, is are these non-native ticks established in Alaska? So a key goal in developing this tick database is to be able to answer this question. And the way that we do this is using the criteria that CDC has for whether or not a tick is established in an area, which essentially is asking, is there evidence that this tick is reproducing? Okay. And so in order to do that, we basically pull out all of the tick records that were found in the state. So this means that they were not associated with any travel history by the host, either by the person that turned in the tick, someone in their household, or an animal. So we have pretty good evidence that this tick was picked up in the state. We pulled out all of those records, and then the criteria for CDC are basically on a county by county basis, which in Alaska, we use our boroughs. These are the maps that you see on the bottom half of the screen. So on a borough by borough basis, in a single year, either 6 individuals of one tick species or 2 life stages. So maybe an adult and a nymph, or an adult and a larva, would be considered evidence that this tick is reproducing in that region. Okay, so when we do that analysis for all of the non-native ticks that we've started to see in the state, we find evidence that 2 ticks, the American dog tick and the brown dog tick, are starting to establish in the state. Nowhere have we found for the American dog ticks that the tick is established and reproducing. We're finding high numbers of these ticks in these jurisdictions from year to year. For a brown dog tick, we have this one borough, which is around Fairbanks, where they technically met the criteria for establishment. Brown dog tick is a kind of an interesting tick in that it is very acclimated to living with humans and dogs and can actually overwinter inside houses. And so I think in this area, the evidence that we found here was all from a single year. Likely there was a local infestation in a few houses. With treating the houses and getting rid of that very small population, that tick is no longer established. So I think that's sort of evidence that it can happen, but is nothing to be worried about in the long term. Okay, so essentially we find the evidence these 2 medically important ticks may be establishing in parts of Alaska. I'm really excited to continue this program and start to accumulate more consistent surveillance records so that we can continue this analysis from year to year and really be on the forefront of knowing if these ticks are emerging and where we should be looking for them. All right, so I'm going to give myself a little coffee break for 1 second. You can't have an Alaskan presentation without some moose. Awesome. Okay. I'm going to move into the very last bit of my presentation, and then we'll take some questions. Okay, so this is, I'm really excited about talking about this study. This is something that we're just finishing up, looking at the health impacts of wildfire smoke in Alaska. So the Alaskan wildfire season is beginning earlier and ending later, and the frequency of large wildfire seasons has increased dramatically. Wildfire seasons with more than 1 million acres have increased by 50% since 1990 compared to the long-term average, so like 1950 to 1989. In parallel, the number of smoky days in Alaska's largest cities has also increased. Prior to 2004, Fairbanks had only one summer in the previous half century when there were more than 3 weeks of significant smoke. But since 2004, it has occurred 5 times, including twice since 2014. Alaskan wildfires have major ecological, social, and economic consequences, but associated health impacts really remain unexplored. Prior to this study, there were none, essentially. So now I'll turn to a study I've been leading to help us understand how wildfire smoke is affecting human health in the state. So from studies outside of Alaska, we know that some of the most direct impacts of wildfire smoke are exacerbation of respiratory and cardiovascular issues. So that's what we focused on in this study. The study location was the 3 largest population centers in the state, which are Anchorage, Fairbanks, and then Matanuska-Susitna Valley, which is that big blue one there in the middle. And our study area included over 65% of the Alaskan population. We looked at the impacts of wildfires between 2015 and 2019. So wildfire smoke is made up of lots of chemical components, but in terms of public health, we're generally most worried about the really small particles, less than 2.5 microns, and people refer to this as PM 2.5. And the reason we're worried about these really tiny particles is because they can reach deep into the lungs and sometimes even make it into the bloodstream. So approximately 90% of total particle mass that's emitted by wildfire smoke consists of these fine particles. And so it's really prevalent, a prevalent part of the pollutant stream from wildfire smoke. So our EPA, Environmental Protection Agency, regulatory monitors measure PM 2.5, but the issue is that these monitors are measuring PM 2.5 from all sources. So cars, wood stoves, or industrial smoke, for example. But we're really only interested in the PM 2.5 originating from wildfires. So we used a novel method to combine air quality data and satellite-based plume information to calculate the daily exposure to wildfire-specific PM 2.5 in our 3 study communities. So again, we used PM 2.5 from our regulatory monitors combined with plume information, and from that we can extract wildfire PM 2.5 specific information. For the health outcomes, we used a database of emergency department visits at all the hospitals in Anchorage, Fairbanks, and Matanuska-Susitna Valley. We looked at daily visits for a number of respiratory and cardiovascular outcomes. These 3 communities, where the majority of the Alaskan population lives, were exposed to between 26 and 43 days of poor air quality due to wildfire smoke between 2015 and 2019. This figure shows the daily concentration of PM 2.5 in Anchorage, Fairbanks, and Matsu. And here we have the red lines show the long-term monthly average, so between 2008 and 2019 in each community. You can see that 2019 was a pretty bad fire season in much of Alaska. In Anchorage, over 1/3 of the days between June and August had 24-hour levels of fine particulate matter considered at least moderately unhealthy for the general population based on our air quality standards from the EPA. Over the past 5 years, Anchorage and Matsu experienced a higher number of wildfire smoke days, but Fairbanks generally had higher concentrations of PM 2.5 during smoke events. So you can, I think 2019 actually shows that pretty well. So you can see Any days over the red line, any days over the red line are higher than normal in terms of the PM 2.5 concentration. So you can see that Anchorage and Matsu both had a higher number of days, but on the days that Fairbanks had high PM 2.5, there was a pretty significant spike. Okay, so we use something called a case crossover analysis with distributed lag models to look at these associations between wildfire smoke and cardiorespiratory hospitalizations. This method lets us see if there was a significant increase in emergency department visits on days with high wildfire smoke, which are, let's see here, shown here is day 0. So that's on the day that there was an increase in wildfire smoke event. Was there an increase in emergency department visits? But with this distributed lag model, we can also look at wildfire smoke up to 5 days earlier. So that's what you see here on these lag days. So on day 5, this is actually looking at the association between emergency departments today and the exposure 5 days ago. So it allows us to sort of see if there's a delayed effect in people going to the ER because of wildfire smoke. All right, we saw the biggest effects for asthma. Oh, same day exposure 5 days earlier. All right, so we saw the biggest effects for asthma, where a 10 microgram per meters cubed increase in PM 2.5 from wildfire smoke was associated with up to a 13% increase in asthma emergency department visits on the same day. We also conducted stratified analyses, and we found that people older than 15, females, Alaska Natives, and people living in Anchorage and Fairbanks were the most likely to seek emergency care for asthma during wildfire events. These emergency department visits were most likely to occur on the same day as exposure to increased wildfire smoke, and then they started to decrease 2 to 3 days later. So people were really going to the ER on the same day that there was a high concentration of PM 2.5 in the air. We also found notable differences in risk for Alaska Natives for several cardiovascular outcomes, for example, arrhythmia and heart failure. And then finally, we found this pretty interesting pattern. So of the three study areas, Anchorage, Fairbanks, and Matsu, Matsu is the most rural of these three. And here we found that initially there was no increase in emergency department visits on the day that we had a wildfire, high wildfire smoke concentration. But then 2 to 3 days later, we observed a 30% increase in cardiovascular emergency department visits. And I think it's pretty interesting, and I feel like it might indicate that people that are living in a more rural community, that it's tougher to get to the hospital. People have to drive farther distances to get there, may delay seeking healthcare during a wildfire smoke event. Or it could be something where people are more likely to sort of say, you know what, let me wait it out. It's not that bad. I don't need to go to the ER. And then 2 to 3 days later, they realize, all right, it's time to go. So I think that's a pretty interesting finding that could have some implications for outreach during wildfire smoke events. Okay, so this is the first epidemiologic assessment of the association between wildfire smoke and cardiorespiratory health in Alaska. We found significant effects for asthma and a higher risk of cardiovascular events among the Alaska Native population in particular. And people living in this more rural region of Matsu Valley had a lower odds for visiting the emergency department for both respiratory and cardiovascular issues compared to those living in the more urban areas of Anchorage and Fairbanks. Something that I found was pretty interesting in particular is because we found these effects in a relatively small population. So most of the similar studies have been done for whole states in the Western US or in major urban centers like in California or Colorado. And so they had huge populations to work with, and we're finding very similar effects to what we found in Alaska. So even the combined population of all of our cities together is much smaller than previous studies. So the fact that we found significant associations speaks to the substantial impact of acute wildfire smoke exposure on the health of Alaskans. And so I think with that, I'm going to close up and turn to the questions. I see that the chat has been blowing up the whole presentation. So I'm excited to hear what you guys have to say.
Amazing. Thank you so much. If everyone could please join me in giving a virtual round of applause to Dr. Hahn for a really informative and expansive presentation. You are right that the chat has been exploding since you started your presentation. We have a few participants who are going to come on and ask questions themselves, but we first have a question from Marilena about other invasive nuisance species. So she wonders if there are any invasive species besides ticks that may cause headaches to Alaskans.
I assume you mean headaches in a general sense, not actually headaches. Yeah, that's a great question. Actually, I was just noticing Tammy Davis is on the call, and who's the invasive species coordinator for our Alaska Department of Fish and Game. So I would totally put her on the spot if she's interested in sort of doing a PSA. I think there are a number of invasive species that are coming into the state. I know, for example, just even on the fishing boat, we sometimes pick up fish that have not historically been found in Alaska. I know, actually, I think I saw Frank Whitmer is also on this call, who's a professor at UAA and has been doing a lot of work with Alodia, which is a plant that is picked up often on people's bush planes when they have floats on them and they are flying from the lake in Alaska where there's a lot of Alodia, and then they fly out to their cabin or to a remote lake, and they'll take that plant with them. So invasive species are certainly a problem across the state. In terms of health impacts, it's a good question. I'm trying to think of any other. Certainly, I mean, the work on ticks has been the most comprehensive. People have mentioned, we don't have West Nile virus here, for example. People have talked about that, but nothing else comes to mind off the top of my head in terms of human health and invasive species.
Yeah, and maybe this is an open question and a reason to join our research coordination network, because health is a critical part of that conversation. And while unfortunately Tammy, I think, has stepped off, we will be including her contact info in the follow-up email. So if anyone has questions about bigger invasive species headaches beyond ticks, I encourage you to get in touch with her. I'm going to ask Ross to unmute themselves and either come on video to ask the question or come on audio to ask your question.
Oh, great. I'm still in bed. I'm sorry. So hi, Dr. Hahn.
Hi, good morning.
I'm not going to show my video right now, but excellent presentation. I lead a small geospatial epidemiology company, and so I want to steal some of your slides.
Cool, yeah.
But I was up in the last frontier 15 years ago. So I guess things have changed. I've been pretty much all over, not to Aleutians, but pretty much, north of Bethel, Dead Horse, all that. So my question is, have you any collaborations with any of the other 8 Arctic nations? For instance, I have colleagues in Novosibirsk, and they're very concerned right now about tick-borne encephalitis, which might tie into the headaches. But do you have any plans for any future collaborations with any of the other in the Arctic Treaty, Canada, Denmark, all that?
Yeah, no, that's a great question. I am still pretty new to Alaska, so still learning the ropes and making my networks. Part of the reason I'm super excited about the RCN, obviously. Probably the biggest tie-in I have is with the International Circumpolar Health Association, and I've been to that meeting and am part of the infectious disease working group there. So I feel like that's usually my first stop shop. I'm looking for someone and say like, hey, does anyone know someone working on this? But I am always open for collaborations. part of the fun of doing this work. So I'll definitely follow up, Ross. I'd love to hear.
Wonderful, wonderful. And maybe I'll get out on your husband's fishing boat.
Yeah, come on.
All right, thank you very much, Dr.
Of course.
All the more reason for us to look forward to an in-person meeting in Anchorage next year. Hopefully we can all go out on the boat, although there might be a bit too many of us for that. Speaking of Anchorage, I'm going to invite on one of my co-PIs, Dr. Chad Briggs at the University of Alaska-Anchorage, to ask his question.
Well, good morning. And Victoria, thank you for arranging for me to learn more about the research of one of my own colleagues.
Perfect.
I would like to ask, how much, in terms of causation, like how much of the spread of ticks is related to changes in air temperature, sort of like pine beetles, the loss of really deep cold in the winter, and how much is maybe attributed to changes in distribution for fauna or human behavior?
Yeah, it's a great question, and it's sort of been the like the underlying current of a lot of the work that I've done. So prior to coming here, I was working for the vector-borne disease group within our US CDC, and I was leading the community of practice of all of the people at the state health departments who were doing this similar work to what I've been setting up in Alaska. So I get to be on the flip side now. And that was the same question, mostly because people wanted to be able to attribute, like, okay, how much of this is attributable to climate? How much is attributable to changing it, especially in New England? Land use is a huge driver of a lot of what we're seeing in terms of tick-borne diseases there, as people are cutting up forests, there are smaller and smaller patches, and that really influences like where deer and mice are sort of moving and interacting with people. And so I think I would just say it depends on where you are. Like I said, I think land use is a huge driver in New England. In Alaska, actually, a lot of it is people and pet movement. I mean, we're seeing that most of the ticks that have been coming into the state that we've never seen here before are arriving on people and pets that have recently traveled to tick endemic areas. So I think like the introduction of the tick is about movement. Whether or not they can establish here, I do think is related to climate. And I think previously, maybe 2 decades ago, if a tick was brought up and it fell off in the woods, it wouldn't survive. Now I think that as we have more mild and mild winters, I would not be surprised to find that a tick that's dropped off in one summer could make it through the winter and lay eggs or breed the next spring. So I can't give you a percentage, although I'll find a paper that might be able to help answer that question quantitatively. Mm-hmm.
We are all for sharing papers in this network and doing some further reading. So I welcome you to share that with us, and we can share it with the whole group. I'm going to ask Yevgenia to please unmute yourself and ask your question.
Good morning and good evening from us. In Iceland, it is already 7 p.m. So
oh my gosh, thanks for joining.
Yes, thank you. Thank you very much for an informative presentation. And I will ask a shorter question, which is something that you have mentioned in the beginning of the presentation. Speaking of Alaska and the climate change and the changing climate, how does the dispersal of the sea ice of the northern part of Alaska, this is me reading the question I have wrote, affect the native and perhaps indigenous population of the northern Alaska, which lives do depend fully from gathering the food and hunting on land and fishing in the sea. What is your thought?
Yeah, no, it's a great question, and certainly there are other people on this call who have studied, have worked with communities in this area and studied this particular climate driver more than I have. So if anyone wants to chime in, I'm all about spreading the Alaska wisdom. But I can speak a little bit to just conversations I've had with people that live in these areas. And a lot of it is about sort of the tradition of whale hunting has been in different communities, sort of either a spring or a fall event, and people sort of have strategies for going out to hunt both whale, but also other sea mammals. And basically the ice is coming later and is not as stable, and people just aren't able to predict when they should be able to go out. In addition, something in particular in Wainwright is another community up there, is the sea captains are talking about just more, they're struggling with more severe storms and more severe weather. And so they, for example, have talked about having better communication with one another. So through VHF radios or, going out in bigger groups of people, they might be able to feel safer when they're out there. So it's just a combination of lack of access, but then when they can access, sort of unstable conditions and more uncertainty in sort of the surroundings and the environment, because they're different than they have been traditionally.
Brilliant. Thank you very much. Thank you very much for answering my question.
Sure.
And thank you for letting me speak.
Yeah, thanks for joining us this evening.
Yeah, lots of appreciation for staying up late and joining us. Sure. We have people across almost every time zone on this call. I'm going to ask Erin to unmute yourself to ask your question next.
Hi, can you hear me?
Yeah, you're great.
Okay, my apologies. I only have a phone to talk on. I don't have computer audio, but I was curious. This was a wonderful presentation, and I was really curious about how you've considered cumulative health impacts. Have you been able to tease out that certain drivers or environmental hazards contribute, X amount to health outcomes, or just how have you considered those cumulative health impacts? Thank you.
Mm-hmm. Yeah, gosh, that's a great question. And I mean, I think I've been thinking about it a lot lately because I've been working on wildfire smoke recently, and it's in some ways it's nice in comparison to ticks. So for example, ticks are very complex ecologically, like being able to say like this X exposure is affecting this health outcome is very difficult, I think, in that system. Wildfire smoke, is still complex, but is a little bit cleaner in terms of setting up statistical models, for example. And so I've been able to sort of tease things out a little bit. I think for things like wildfire smoke exposure, that question of cumulative impacts is a really important one and something that people are talking about a lot lately. In the 10 years ago, there weren't as many studies on wildfire smoke 10 years ago, but even in those studies, the exposure itself is treated as transient. So like, all right, you had a bad wildfire smoke day. How did that affect health? And we're seeing, for example, California this summer, they are no longer like one-off short events. There's sort of these really long-term exposures, both within a season, but also repeated, season after season. And so I think that's a really important question in terms of like, how are these cumulative exposures, these things that are no longer one-off events, really affecting our health, either our chronic health or sort of on an acute level. One way that I'm trying to address this is sort of to look at different types of health outcomes that are affected by wildfire smoke. So for example, I'm working now on some study to look at birth outcomes and wildfire smoke in Alaska. And so that sort of is like one step closer towards like, how is this affecting our long-term health and sort of the, healthy development of the next generation. But it's a great question and a really important one that's tough to unravel. But thanks for that question.
Thank you. Yeah, it wasn't an easy one, but like I said, I was just curious how you thought about it, and I'm glad to hear you are. Thank you.
Yeah.
Thank you. We have a request from Zane. If you could show the slide from the frameworks linking climate drivers to health outcomes, and maybe just briefly speak about that slide before going on to our next question from Susan.
Yes. Oh, here, I'm gonna do it this way. You're thinking of this one, right?
Yes, he says yes.
Okay, perfect. Yeah, I'll put up this one that has basically the, okay, well, I'll explain here again. So this is basically just a way to link a climate driver, so that specific climate change. So these, here, I'll go back here. So for example, the framework basically links the center circle to the farthest outside circle, essentially. So how do we get from rising temperatures to heat-related illness and death? Or how do we get from more extreme weather to more West Nile virus, for example, or rising temperatures and asthma? All right, so we get here through this framework where essentially a climate driver is that inner circle. It's the specific climate change that leads to an environmental condition. The environmental condition then affects the environmental hazard, which is the thing that causes the health impact. So for example, increased precipitation causes flooding, which causes contaminated water, which then can cause waterborne infection. I'll briefly also say sometimes the environmental condition and environmental hazard can be the same thing. So for example, if flooding causes injuries or drowning, that basically skips over the environmental hazard. So in that case, flooding is both the condition and the hazard that are creating the health effect. If that makes sense.
Thank you. And Zane also says thank you in our chat. I'm going to ask Susan if you would like to unmute yourself and come on to ask your question.
Yes, good morning. Thank you, Dr. Herman, and thank you, Dr. Hahn, for a very great presentation. I'm wondering, with the melting permafrost and the different items that are being uncovered, is there an ancient tick and its disease that could possibly present a problem as more and more of the permafrost melts?
That's a good question. That's a fun one. I've actually no one's ever asked me that before. Ticks are pretty hardy. I think they would have a hard time existing in permafrost, I have to say. I'm just trying to think of, definitely they've survived some pretty cold temperatures and overwinter really well. But yeah, I think that would, maybe pathogens, bacterial pathogens. But again, a lot of the, specifically for tick-borne diseases, a lot of the pathogens survive within the disease ecology complex of the ticks and the hosts, and don't survive in the environment. And so that would probably be not one that I would be super worried about in terms of thawing permafrost.
Thank you. And I would also suggest that if you are interested in permafrost degradation and the consequences of that thawing, we presented a webinar last month with Dr. Kimberly Rain-Miner on permafrost degradation. And she actually has a new publication out that we'll be sharing with our network on microbes and permafrost. So I would suggest looking back at our past webinars to learn a bit more about permafrost. I am going to ask Frank if you would like to unmute yourself and share a bit about the tick habitat modeling that you are doing with our audience here, but also those watching on the recording later.
Yeah, that'd be great.
Sure. Yeah, I've been working with Micah for the last few years on some tick habitat modeling, and basically we're taking existing models that have been calibrated for the lower 48 through the CDC and also a California model, and then projecting them to Alaska, both the recent climate and then also future climate out to 2070 to 2100. And we're just working on finalizing some of the results and writing it up for publication. But basically, depending on which model you look at, it's again an ensemble modeling approach. So when we combine these models, we find that in places, like in southern, south central Alaska and southeast Alaska by Juneau, it's already pretty good habitat for ticks. And going forward into the future, typically the habitat expands a bit, as temperatures warm and precipitation changes. And again, it depends on which models you look at, but that's the general conclusions that we're coming to with this research.
Great, thank you so much for sharing. Dr. Hahn, I didn't know if you wanted to add anything to that.
No, I think he's got it. I think I'm excited to finalize our results on the project, mostly as sort of a proof of concept that, yeah, we've got some good habitat here. It really is important to understand sort of which tick species are coming in and to do a lot of outreach to people that are traveling to know that this is an important concern. A lot of pet owners in Alaska, myself included, don't use tick prevention on our dogs when they're in the state. But when you're traveling to, my folks are in Tennessee, for example, when we're traveling home, it's really important to put dogs on tick prevention when they're traveling and coming back to Alaska for this reason. So just being able to show people a map to say, we've got good tick habitat here, I think will really help with that, that outreach. So.
Yeah, absolutely. And that actually leads to another question we got about outreach. So this participant wanted to know how you conduct outreach with communities and specifically Alaska Native villages that might be impacted by fires or ticks.
Oh yeah, it's a great question. Well, I'll speak to the tick project. So for that one, I think it was really key. So I'm at the University of Alaska, and I think it was really key for us to create a strong partnership with other organizations that are already working in lots of communities. So for example, we are working with Fish and Game, which has local offices in a lot of the rural communities, and people are really familiar with going to the Fish and Game office for hunting tags and that type of thing. And so by creating the program in existing organizations rather than trying to have our own sort of drop spots or that type of thing, we felt like that was a really, low-hanging fruit way to get into lots of different places throughout the state. And in terms of wildfires, I've mostly been working actually with secondary data at the moment, and haven't engaged with communities about some of this work. We're putting in some proposals to do this. And I think actually a lot of times communities are coming forward to, for example, we have the Alaska Fire Science Consortium as sort of the group of organizations working on fire management in the state. And they have really good ties with a lot of the communities in wildfire affected areas. And so again, working sort of through these established networks that have connections to local communities has often been a really useful approach for me. And I'm sure everyone has lots of different strategies, but that's usually my first go-to.
So we have about 10 minutes left. If anyone has questions, please put them in the chat or raise your hand if you are calling in with us today. We have one more question queued up about mental health that you mentioned earlier. And this participant wanted to know if you could speak a bit more about mental health in relation to climate health risks, and if you are working with any mental health organizations or practitioners about climate change and public health.
Sure, yeah, no, I'm happy to. I guess one of the projects I'm working on right now is looking at the mental health impacts of the wildfire season last summer in South Central Alaska. it was a pretty severe season in terms of wildfires happening sort of both down on the Kenai Peninsula and then also north of Anchorage. And so there was a sort of belt of fires that were happening over the course of the summer, which meant that in addition to like the stress of the fire in these communities, it was very smoky for like I said, in Anchorage, a third of the summer, we had unhealthy air quality levels in the city. And so people really noticed, even if you weren't living right next to the fire, you noticed the smoke, and it affected your daily life basically for the whole summer. And so right now we have been doing interviews with people living in Anchorage and the Kenai Peninsula about sort of their experiences with the wildfires last summer. And it's been super interesting. We were actually just looking at some of the interview data the other day in terms of the diversity of things that people said they were anxious about or caused stress. A lot of it on the Kenai is a really big tourism area. And so with the smoke, but also there's one road in and out of that area. And so there were roadblocks for a lot of the summer. It really affected tourism. And so people were actually really stressed out about their income and about sort of what they were going to do if they couldn't bring in tourists for the summer. There was a lot of stress about, of course, health effects. I mean, everyone mentioned sort of the smoke and not being able to go outside. It was simultaneously very hot. And so people were sort of, I mentioned this earlier, we're dealing with that dual exposure. In addition to, so tourism and health, also, there was a lot of sort of frustration, I guess, with the way that either people felt like there was lack of communication about should they be evacuating, should they not be evacuating? Like, is this a health concern? Is this not a health concern? Like, they felt like they didn't know what was going on. And also, of course, I imagine, and this is the very common in like lots of fire situations, but people were really frustrated with their perception of how the fire was being managed. People were like, well, you're letting this burn, but it's causing a lot of smoke problems and causing problems for me. Why are you doing this? And so it was really, I come at everything from a health perspective. And to me, I'm like, your health is the most important thing. Like, why would you be worried about, like, this is obviously the thing that's causing stress for everybody. But it's interesting to see like the diversity of stressors during this event that all impact human health. So we're all getting to health eventually, but like people are worried about not being able to pay the rent this summer. And that's like the thing that was really causing the most anxiety. So it's been pretty interesting. And I hope to keep expanding that work a bit.
Yeah, and I think that's, a critical thing to continuously keep in mind, that the biggest anxiety and the biggest issue facing any community might not be the issue that you are most interested in, and finding ways for meaningful collaboration, not just for your work or lab, but for all stakeholders involved. And this brings us to a question from Cecile about how you come to your research questions. Are these research questions that come from communities, and are your research projects welcomed by Alaska Native communities? So is it co-creation or something of a variation of co-creation?
Yeah, it's a good question. I'm just trying to think back to like specific projects. It's so different for every project. I feel like, there are some situations, like for example, we were working with Wainwright, which is a community up on the northern slope of Alaska. And they actually they had the whole project. They said, this is the project that we want to do. Can you help us basically? And contracted us out to help them evaluate this. They're one community, for example, that's dealing with unpredictable weather conditions. And so they're trying to go traveling for fun, for hunting, for getting somewhere in the wintertime. And we're finding like people were getting lost or like a snow machine was breaking down or having some kind of trouble. And because there wasn't sort of two-way communication between search and rescue and these people, a lot of times people would sort of they had like a spot. And so they would send an SOS message back to the community, and search and rescue would, which is a volunteer organization, would launch and look for this person, they would find them and to find out that, oh, they ran out of gas in their snow machine, but they were fine. And it's like, wow, if we just had a better two-way communication, we just could have used resources a little more. This is the community came to this themselves. They thought this is the solution that we need. We want to know if it's working. Let's work with the university to help us sort of evaluate this project. So in that case, you know, I was like a servant of the community in some ways. In other cases, you know, a lot of the work that I'm doing recently are questions that have been brought to me by health departments. So like our local health department or the state health department, because there's sort of these big picture, what's going on either statewide or like with this, you know, on a public health, like the question is, are our hospitals being inundated during these smoke events? And what day, you know, when should we plan for seeing surges in people coming in when we have wildfires nearby, for example? And so I guess all of my work is applied. Where the question come from is very different. Sometimes it's directly from a community, sometimes it's from a state health organization or another collaborator. If that makes sense.
Yeah, it does. Thank you. So we have just 5 minutes here. So I think our final question is coming from Erin, and she would like to know if you have incorporated traditional ecological knowledge into your work.
Yeah, that is a great question. I would say that in terms of the frameworks that we use and in terms of the sort of the way that we approach questions, sort of looking at it from a very holistic point of view, I would say definitely. I mean, up here in Alaska, it's been really fun in some ways because this One Health framework, this idea that human, animal, and environmental health are all intertwined is very prevalent. It's like a very normal part of everybody's life. And it's something that I talked about a lot in grad school, but was sort of felt like I was a fish out of water. And sort of being able to sort of have that baseline foundation and like people, you talk to community members and they're like, yeah, of course, we depend on all of these resources. This is really important for us. Has been, it's been great just being able to sort of dive in with that common understanding. I think that there's I'm very excited for sort of the next phase of my research in terms of, you know, we've been doing this work with secondary data. Let's sort of see what we have out there. Let's see if we can find evidence of these health impacts. Once we have that information, sort of have that baseline, to me, the next step is then sort of more community participatory based work where we can focus on specific communities. We can sort of integrate more local information to sort of to dive in deep and think about, all right, we know that there's this association, for example, between smoke events and mental health or cardiorespiratory stuff. What's going on in your community and sort of how can we use that information to help inform adaptation approaches? And I think that's like the key time when a lot of the traditional ecological knowledge can come in to help develop adaptation solutions that, you know, will work in communities and that people think are, you know, will work for their daily lives essentially. So I'm looking forward to that next step.
Yeah, and we are all looking forward to seeing what comes of that next step. So I think we are at about time, and I just want to thank you so much, Dr. Hahn, for an incredibly informative presentation and I think an even more informative discussion of everyone's questions and answers. And I hope that everyone finds value in these virtual meeting spaces and joins us at our next webinar next week on December 8th, next Tuesday. It is at 11 a.m. Eastern time, so a bit early for Alaska, but also a bit earlier for our European participants. And that webinar is on Arctic border management, and we'll learn about the history of Arctic land and maritime boundaries and how climate change is creating new challenges to border management from 3 really incredible presenters. But beyond next week, I hope that you join our research coordination network for the many webinars and programming that we will put on in 2021, and hopefully in-person events in Alaska, in Washington, DC, and in Sweden in the years to come. So thank you everyone so much, and I hope to see you all at another webinar soon.